Welcome, everyone. I'm Dick Deming, Medical Director of Mercy One Cancer Center and the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It's brought to you in part by a grant from the Iowa Oncology Society. And our guest this evening is Kathy Koenig. Kathy, welcome. Kathy is a mental health counselor and also a certified grief counselor, and she happens to be the caregiver counselor at the Mercy One Richard Deming Cancer Center. So welcome.
Oh, thank you. Good to be here again.
And you've been our guest before,
Yes.
and this is a popular topic. It's how do patients and families navigate their way through this thing we call the cancer journey. But we're also going to focus on a new program that you're developing with Above and Beyond Cancer to provide some extra support for the care partners, family members of cancer patients who are going through the journeys with the patient as well.
Yeah. I was really excited when Mary Van Hukelum contacted me and said, you know, the caregivers are starting to approach me and say, well, what about us? What have you got for us? So she contacted me to say, what do you have? What do you have for me, or what do you have for us? And I was pretty excited to be able to share with her some resources that I've been using over the last year or two, and ready to expand that a bit beyond. And so we decided that we are going to focus on this, hope for the best, plan for the rest.
Yeah, a great book.
For book club this fall.
Oh, great. And the book is written by two physicians, one a medical doctor and one a psychologist.
No, they're both
medical doctors.
Both medical doctors.
Okay.
Dr. Sammy Winemaker and Dr. Cian Xiao, and they are palliative care physicians in Canada. Dr. Winemaker actually does home visits. She's like, old school, goes to the home and sees patients and families in their home environment. And Dr. Xiao works. And so they've worked together for some time. They have a lovely podcast. They've written this book, which I have used in my practice now for the last 2 years. And then recently they bestowed upon us a companion workbook that I think is excellent, and developing actual workshops out of that. So they just keep handing me tools, and
well, we are going to do a dive into that.
Yeah.
Before we do, let's get to know you a little bit. So refresh our memory. Where did you grow up?
Here in Des Moines.
Right here in Des Moines, Iowa.
Born and bred.
Which high school?
Actually, 2. I will claim 2.
Okay.
This is going to age me, and I guess that's okay. I went to St. Joseph's Academy for 3 years, and I was in the first combined graduating class from Dowling High School.
So for those who don't know, that was the girls' Catholic school. And while you were in high school, it merged, and Dowling then became co-ed.
Yes.
So you were the first in the first class that graduated from the co-ed Dowling.
Yes, it was a tumultuous transition.
Yeah, I hear that not everyone, not all the boys or the girls or the teachers were excited about that co-ed thing.
No, not at all. Not at all.
What was your claim to fame your senior year in high school?
Mine?
At the co-ed Dowling?
Oh, gosh, I don't know that I had any claim to fame, but what I would say though is that I had a male teacher who was my economics teacher. He was also a basketball coach who saw more potential in me than I think others had. And he really pushed my grades from a lower all the way into the A category.
Wow.
So
yeah, having a teacher that recognizes the talent can change one's life.
Yeah. So I think when we can mentor and coach people and we see there's a capacity there.
And then what did you do when you graduated from high school?
Then I traveled very far away to Ames, Iowa, where I went to Iowa State.
And what did you major in?
I toured a few different departments before I ended up in social work and sociology.
Okay. So you found that pretty early on.
Yeah.
Okay. And then through the years, you have been a counselor and, kind of like lifelong learning, continuing to expand your knowledge and certification in the world of mental health counseling. It's like alphabet soup. There's so many different types of training.
Right.
But your master's is in
I have a master's in counseling. I got my master's degree at Drake, and while I was working for a competitive health system here, and that led me into doing work in adolescent mental health, and then furthered on. So I've done trainings in family therapy, and worked in private psychiatric groups, and yeah.
Okay. Marriage counseling.
Yes, marriage
Little bit of
counseling,
family
yeah,
counseling.
marriage and family counseling. But my love, I think, has always been in the area of health-related issues, and so I like older people, and I like health-related issues. I was very fortunate when I was working in a health system that I got to work with physicians who specialized in rheumatology and neurology, a lot of headache, pain management kinds of things. Um, so
Right.
I
So
loved
chronic diseases
chronic
where
diseases.
there's
Yeah,
not just a quick cure.
no,
Yeah.
no, and physical rehabilitation.
Yeah.
So yeah.
And at the Mercy One Richard Deming Cancer Center, a lot of what you do, I would say, when I think back of all the patients is, there are many patients that are living with advanced cancer or even living with incurable cancer, and just the philosophical perspective for the patient, but then also for the family members as they also are dealing with the disease. And sometimes you've got the patient and the caregiver wanting to bolster each other and feel like they can't show any sort of negativity or pessimism. And so having a independent counselor that can help our caregivers has been just invaluable.
Oh, thank you. I've enjoyed it.
Yeah.
And yeah, and sometimes too, it isn't just patients that you're seeing who have a diagnosis. Very often what I'm seeing is that very often the caregivers or care partners may also have a cancer diagnosis or other
Mhm.
health-related things. So you can have two fairly serious chronic
Mhm.
illnesses happening in the same household.
Right. One might have cancer. They both might have cancer, or one could
Cancer,
have cancer, but the other one
Parkinson's,
is, yeah.
it can be lots of different combinations.
So let's talk again about the book, and why don't
Okay.
you show it, because this is a really wonderful book that you
Yes.
didn't write, but
I did
you
not.
you have been using it as sort of a map to help others. So hope for the best, plan for the rest. 7 keys for navigating a life-changing diagnosis. Why don't we kind of go through those keys, and these can serve as a sort of a touchstone, a category of thinking about approaching a life-changing disease. And this book is not written just for individuals facing cancer,
No.
but really for any significant
Yes.
life-changing medical diagnosis, or really even probably a life-changing catastrophe.
I think it's got a lot of transferable qualities to it. I think you can insert different issues into it, and the people who have written this, are also creating more materials that are sometimes more disease specific, maybe for dementia issues, and they're making handouts for that, or ALS or whatever, because some things are going to have different pathways, but the 7 keys are really relatable to so many things. And the first one is walking 2 roads. What road, it's like, how do you stay positive after you've received a diagnosis? It changes your life. It's not something that goes away. It's always sort of there as I pick up that.
So
But
it's a tension between being brutally honest and leaving the window open for hope. How do you know the details? And the detail might be that this is a treatable but not curable cancer. How do you want to know the facts, but you also want to have room for optimism that things may turn out better than you anticipate.
Right. And one of the questions that they ask, as a prompt, and there's lots of good questions and prompts in these books, but is, what are you hoping for and what do you need to plan for just in case? So that offers like, well, this, but what if? And so it is those 2 roads, like, just in case this doesn't happen. And I think knowing that for yourself, and then also then being able to convey that to your partner, to your family, to your circle of people, and to your care providers. Knowing that for yourself, this is what's really important for me.
Mm-hmm. And there's not a right answer.
No.
People go, well, should I retire? Should I sell the house? Should we downsize? Should I go on disability? Should I continue to work because I can and I enjoy it? Not a right and wrong answer, because no one has the answer for how long are you going to live, and how much strength and capacity to do the activities you want.
Right. And some of those things, I think we've seen some things you might have an answer to right away, but not all of them. And so I think sometimes it's like, let's not eat the elephant all at once. Let's just do it one bit at a time and take one thing at a time to reduce the overwhelm, because there's a lot of overwhelm. And
yeah, I think of one patient in particular who is doing quite well, living with an incurable cancer. But when he got the news that his cancer was not curable, he was under the impression like it was 6 months to a year. And this is like 5-6 years ago, and made life changes that were dramatic, that had he had this understanding that not everybody's prognosis is as dire as he was led to believe, he may have gone a little more slowly in how he changed his life.
Yeah. And I think that leads to like the second key, which is zoom out.
Okay.
So there's a more immediate picture.
So what's the big picture?
What's the big picture here? And, like some illnesses can sometimes have a known pattern to them. You are able to explain a pattern to somebody so that they know what to expect or what could happen. And so understanding that may give you a bird's eye view of, here's what I want to achieve now. And here, maybe I can do this now versus later, or maybe I just need to focus on this now and later on I can do this.
Yeah. Here's what's possible.
And revisiting it. So,
I think that is so important. And I think sometimes we can, unfortunately, in those situations, a glioblastoma, that's a large tumor in someone in their 60s or 70s that's already quite symptomatic. I mean, we know that it would be unlikely that that person's going to live more than a year. Or someone with a traditional pancreas tumor and liver metastases. I mean, we know the big picture view is this we can hope for the best, but the big picture view is this is likely over the next year to really deteriorate and result in death. But then you get situations where people hear stage 4 cancer and they think, oh my gosh, but there are women with stage 4 breast cancer that can live over a decade with excellent quality of life. Men with stage 4 prostate cancer that are still responds to hormone therapy that can have a very good quality of life for a decade. So those are ones where the knowing kind of what is the pattern of this disease can be very helpful.
Right. And in fact, I can share that this book was published in 2023, which was also around the time that I had a sibling diagnosed with glioblastoma. And so I bought a copy for my sister-in-law, who inhaled it and loved it. She found it to be so helpful as she was having to deal with that. And then she made all of her siblings buy a copy. So because, it just like it has great stories in it and examples, but it also calmed her nervous system, which is something we're also looking to do, or I'm also looking to do, and I know you do, as also Above and Beyond Cancer does, to calm things so that we can see things. But the prompt question for that is to ask your provider, what will my illness look like over time, and what can I expect along the way? And so that then you can begin putting together your own pattern, your own pathway, because it isn't going to be exactly like somebody else's. Right. So I think it's also not getting caught up in other people's stories or fear and
Mhm.
yeah.
But knowing individuals that have a long history of living with incurable cancer, and I've already mentioned, breast cancer with bone metastases or prostate cancer with bone metastases. Some lung cancers that have mutations that targeted therapy. You usually think of lung cancer stage 4 as resulting in death within a year or two, but we have many patients now that have particular types of lung cancer with particular mutations for which they have an excellent quality of life for many, many years. So being involved with groups like Above and Beyond Cancer, where you also get the opportunity to see other individuals with an advanced cancer who may do quite well for a long time.
Yes.
Number 3, know your style.
Know your style. Yeah, we all have different styles, and our style about our healthcare and we all have a body, so it's not something like, well, I don't need to know about this or that. Like, I don't have a boat, so I don't care about that. But I got a body, and so I need to know what my style is about my body. I know what my style is in terms of, like, when I'm talking to my physician, like, we have, I think, a collaborative approach. Like, he talks to me and says, let's, we could do this, this, or this. And he pretty much knows I'm going to go for, let's do the least intrusive thing first and go from there.
But you talk about the options.
But
You want to know the
yeah,
options.
you want to know the options, and you want to know, because sometimes too, people also don't want information. It's like, don't tell me everything. Don't tell me, just I'll do anything you tell me. And their care partner might be saying, oh, hey, wait, I have questions. Or that's not how I want to approach it. Or, so it can be very different within a family system. Or I think sometimes too, you might have rolled along in one fashion and then you get a diagnosis and whoa, your style can even change.
I think of, I'm a visual person, and scans, like PET scans, are actually easy to understand with someone showing them to you. And I always find it helpful to be able to see, especially when you get into before and after. And so I'm generally bringing the scans up, and most patients do appreciate seeing them, and it can help them visualize. But then you get some patients who go, I don't want to see the scans. And I remember one patient, the first few times I would be fiddling to bring it. She said, remember, I don't want to see it. But her spouse wanted to see the scans. So we would figure out a way over the course of many years where her, I would always say, you sure you don't want to see it? Because I think you're going to be pleased with, no, I don't want to see the scans. So know your style.
Know your style.
And for individuals to know their style, but then also to share what their style is with their care provider.
Right.
Do you want to know all of the options and then a discussion of the risks and benefits? Or some patients say, you're the doctor, you just tell me what you think I should do, and let's just go with that.
Yeah. And I think it sometimes what I hear from people is it depends on the particular provider they might be seeing on a visit, that person might offer more information. And so they come to almost have that sort of interaction with that provider versus somebody else. But I heard a story just this week where people, as you talk about being visual, they were trying to understand something that was being explained to them. And then the PA said, how about I draw this for you? And it was absolutely illuminating for them. It's like, this is where this is, and this is what it's doing. And they both said it was so helpful because they were much more visual learners. And also having that, I said it's different than if somebody's told you something and you go home, and you're an auditory learner, you go home and you try to tell somebody at home about it. They're visual. They don't have a clue what you're talking about. So, I think sometimes if you can also reinforce to a provider, I really like it when you draw for me, or just tell me, or can we write that word down? That helps me. I need to digest this over time.
Number 4, customize your order. So what do you mean by that?
Well, customizing your order is kind of tailoring your care to match your values. What's important to you? I think about a friend of mine who was she was very particular about what she wanted her care to look like. And sometimes she could maybe butt heads a little bit with her physicians because she would say, "No, I'm not going to do that. No, we'll do this and this and this, and nope, we won't. I'm not interested in doing that." And but she just felt like she really wanted to. She knew what her capacity was for certain things, whether it was a surgery, whether it was chemotherapy. She would do radiation, not chemotherapy, this and that. And she was and sometimes she'd be thinking, yeah, but, and her husband would sometimes be like, oh my, but he also knew her well enough that he wanted to respect, and we all wanted to respect her position. She's somebody who comes to mind.
Yeah. At least a dozen times a day, I will say to patients, you're the boss. I work for you. My job is to explain things and to talk about the options and the risks and benefits and help you figure out what you want. Occasionally there will be patients that are so, we might use the term hard-headed or stubborn, or you might say so sure of themselves that they might be making decisions that I would think is not even in their best interest, but I respect their ability to make the decision as long as they do know and understand to the best that I can communicate the risks and benefits of the various options.
Yeah, and I think that that's probably an opportunity to invite them to think about things and say, go home, think about this, and we can talk about this again or get back with me. So it doesn't have to be an on-the-spot event. It also gives them, if their care partners are with them, an opportunity to go home or fuss in the car. I hear these stories about like, why didn't you ask this? Or I don't think that, or whatever. And to kind of work it through instead of it being, and to just kind of sit with something for a bit.
And there is some flexibility also. Now, obviously, if the decision is to do a big surgery that is that may risk one's life, I mean, once you make that decision and you go under anesthesia, there's no going back. But with other forms of treatment like chemotherapy, 6 months of this chemotherapy, well, you really only have to decide you're going to take the first treatment. You can opt out at any point. So for some patients who think, I don't want chemo, I never want chemo, but they have an incurable cancer and that might be the best treatment, it's like, you can give it a try, see if it works, see what the side effects are, without committing to the whole course of treatment. So that allows some people to maybe stick their toe in where they might not otherwise want to tread.
I think that that's really a beautiful response to people, is like, we can try, because I'm not sure anyone ever hears we can try. It's like, you must do this and here's what's going to happen. And I've heard people, they've come to me and said that this doctor said, you have to give me a year of your life. And they're like, that's my friend. She was like, no, I'm out of here.
I don't know you well enough.
Yeah. Yeah. Can we, let's get to know each other and let's build that trust. But I think knowing when any of us can know that we still have control over something and to say, this is too much, or
Yes. We have never sent the highway patrol out to bring someone in and strap them down and give them treatment against their will.
Yeah.
They are the boss.
Right. Although it doesn't always feel like that.
Yes. Yeah, definitely.
Yeah.
Anticipate ripple effects. There's probably some positive ripples and some negative ripples that can happen.
Yeah. I always say to people, I think as sensitively as I can, that it isn't just the person who has been diagnosed physically with an illness, but everybody in the family ends up with this at some level.
I see. So is the analogy is the patient is the focus, the drop and the ripples come out from what they're experiencing.
Yeah.
But everyone around them is then experiencing the effect of their cancer journey.
Yes, you know, people take on different roles. Maybe they're just, temporary, taking over some things while their loved one is, going through treatment and doesn't have a lot of energy. Or sometimes some of those roles are a little more permanent, and it's like, how do I fit that into my life? And then there's the loss of their independence, and so all the feelings that can come up that sometimes people don't. The connections can at times get fractured because people think, well, I can't tell them this because they have cancer, and one doesn't trump the other. It's respecting both, or at least giving them an opportunity or an option to maybe individually be talking it out with somebody like me or with some of the other professionals we have to kind of work out some of those dynamics. And then I think as some illnesses can progress, then the balance can begin to shift in the relationship as one person has to function more and one person cannot function as much. Sometimes the roles change, and it's like this person feels more like they're a nurse or they're caregiver, and it's like, I'm no longer this spouse. I'm just, I've lost these connections that we've had for so long, and they're so valuable. Or sometimes too, I've had people say to me, we don't talk about the normal things we would have talked about before. I don't feel comfortable sharing. I don't feel like I can just share with them like the fuss I had with somebody at work and I would have told them those stories before, but now I don't feel like I can because there's too much. They seem
trivial compared to a life.
Yeah, so it's that. It's
Diagnosis.
the roles. It's sometimes the ripples can also be the people who kind of disappear. And that's a really
when I think
story.
of positive and negative ripples, so some positive ripples is you actually can develop closer, deeper relationships where you let the small things go away and you focus on meaningful things. But I've also seen where a diagnosis might tear a marriage apart and end up in a divorce in the midst of one of the partners going through an incurable cancer, where the other one is just feels like they have been left out and are expected to give up everything they've wanted to spend the next few years just devoted to the illness. Yeah.
Sometimes there's anger that people have, and they don't necessarily feel like that's okay to have. But I think when I'm able to explore that with people, we can get down to the anger and letting people have the anger, let that move through. But sometimes there are other feelings that are underneath the anger. Sometimes fear is hidden down there, but anger's on top of it. And I think that kind of goes back a bit to the know your style. If something comes up that's been this huge challenge that you only think my only option is to run for the hills, it's like, well, let's figure out your style. And is there another way to knit this? Maybe not, but maybe.
And as we talk about this, it reminds me that let's say it's a couple that they each have their separate life and they do have their own issues. And as we've already mentioned, they sometimes feel like they don't want to burden the other one with their issues. So one of the reasons that we believe strongly in having a counselor for the person with the cancer, but also having a counselor who meets separately with the life partner who is going through a journey.
Yeah.
So now we're up to number 6, connect the dots.
Yeah. So connecting the dots is, and I don't even think that none of these need to be in a specific order. Like, we have to wait to get 6 before we decide who's kind of the crew of our lives and who's going to do certain things. It's very often, and that's one of the nice things about the worksheets that I have, is that they're actually, you can draw on there and you can like label like who belongs in this circle or this circle or this circle based on the roles that they play, and who are the people Who is good at what?
So it's a little bit of division of labor.
Yeah.
Like who in your life might be the go-to person for
Right. Who's good at making phone calls? Who can call that insurance
who
company?
can, who can
sit
cook
on
dinner,
who can
who
cook?
can give kids a ride
Yeah,
to their soccer game.
Exactly. Who's got the patience for sitting on the phone and, talking to the insurance company or fussing through
Who
that
can go
stuff?
to the doctor with me and
Who
take notes.
Right. And, that's one of the things that Dr. Sammy talks about. She does a number of videos like on Instagram, TikTok, whatever, but also in their podcasts is she really notices right away who's the person in the room taking notes, because she knows that person is, somebody who's the scribe, and usually you need a scribe. And so, but yeah, who else is there and why are they there and who are the ancillary people? Because sometimes you're in an outer circle. Doesn't mean you are caring less, but your role is maybe less hands-on, but you're the person that gets called to say, can you pick up more laundry detergent and deliver this? Absolutely. And
I think we're going to get into the worksheet, but let's go to the seventh key for navigating a life-changing diagnosis. And that they entitled Invite Yourself. So what does that mean, invite yourself?
I think invite yourself, it's the question that they say to ask is to seek information so you can understand how to plan, prepare, and make decisions. So this is sort of not sitting passively in a healthcare exam or event. If
So
you
to be
are
very active,
to be active and to
ask the questions.
Ask questions, knowing how to ask questions. Sometimes what I will suggest, because people say, boy, they didn't give much, or they didn't even offer to ask questions. They were out the door, but I had questions. I'm like, okay, so let's create a strategy where
as one foot is out the door, the doc is leaving the room without saying, do you have any other questions? And they're going, wait. And the body language of the doc leaving the room is that I don't have time.
I don't have time. And one of the strategies I have suggested to people is to, before the appointment, before you're in the midst of it, to maybe come with your top 2 or 3 questions for that visit, for that appointment, and to write them down. And you write them down and you have copies of it so that you, and to hand that off to the nurse who's going to see the doctor beforehand. So before they come in, they're kind of like, okay.
But keep your own copy.
But keep your own copy.
You hand off to the nurse might disappear.
Well, right. But it's also, and so, the provider might come in, the doctor might come in and go like, okay, so we're going to talk about these things today. But you're like, yes, I have mine too. So that isn't like, oh, shoot.
It is good. It is good.
Oh, we got off track. We didn't ask that. And really, that should have been number 1 instead of 3.
As a doc, when I see a patient with, I see you have a list of questions. Let's make sure we go over those.
Right. And knowing that not everybody has the time that you give to people. So knowing that time is limited, that's why I say maybe your top 2 to 3 questions for this visit. And maybe that's also what you do if you're going to chemo or radiation. You have different questions depending on who you're interacting with. If you're going to PT and or you're coming to me or whatever, it's like, bring your questions. Right. I want to know what they are. And so, because it also, and I think also for the care partners, it's making yourself known, that like, I'm not just the driver. I'm part of this team. I'm part of what makes this work. And what we know is that caregivers provide billions of dollars of unpaid care in this country. It's billions with a B. And in the state of Iowa alone, we're looking at anywhere between 330 to 350,000 unpaid caregivers.
Yeah, the number of
numbers are,
yes. Yeah. So let's give us a little flavor with the worksheet. So if you're working with a patient and family, and so the worksheet can be used for either the patient with cancer or the family member.
Right. And some of these are worksheets I can't do with them because I'm not a medical person, but the first one is the illness roadmap.
Gotcha. So that's
And
more the factual about the
right.
disease,
And
more for the doctor to
right.
help
Am
them.
I in the beginning stages? Am I in the middle? Am I in a late stage? Or am I in end stage? And maybe somebody thinks they're end stage and they might say, no, you're up here at the middle.
Yeah, or someone thinks that they are going through treatment that is designed to cure them of their cancer and
Right.
don't understand that this is to try to get it under control, but it's not curable.
Right.
You see that sometimes where there's just not clear communication about the goals.
Right. And then to go along with that, there's a planning roadmap that's also color coded similarly to match that. So it has different questions, or like if you're at the beginning, it's like, what medication should I be taking? How do I make what's my visit schedule going to be like? And after a while, people have their calendars full, but then you're in the midst and it's like, all right, I'm needing more help now at home. I don't have as much energy. How do I get help? Who do I ask for help? Those kinds of things. And then, I have clients I work with that it's like, it can be one visit we can be talking about one thing, and the next the person's calling me to say we're in hospice. It's like, whoa, what happened? And they say, yeah, things just shifted very quickly. We went into another gear very quickly. And so then they can jump from middle to late very quickly sometimes. And but it offers, I like this one. Help me ask the right questions. I remember listening to one of their podcasts one time, and one of the examples they gave was, say somebody was at the end of treatment and they asked their doctor, am I going to have scans when I'm done? Okay, that's a good question. But what Dr. Sammy said was, perhaps a better question is, what will my aftercare treatment look like? So that can include scans, blood work, visits, whatever. So it's a little bit that big picture than just like, will I have scans? It's like, so like, and I think this helps, like, what can we do now to be as well as possible? Which might be somebody saying, Above and Beyond Cancer can be a really good resource for you.
Exercise, help reduce stress. Those are key things that can help regardless where you are. But
what's important to, what are important things to prepare for next? And they might say, well, we're going to finish this, and then we're going to prepare for maybe for reconstructive surgery. And
so these sorts of questions remind me of the famous quote by Sir William Osler, sort of the father of American medicine. The good doctor treats the disease. The great doctor treats the patient who has the disease. So sometimes those oncology appointments are all about killing cancer cells and not so much about how do we bring healing and joy into one's life in the midst of killing cancer cells.
Yeah. And so all of the handouts track really beautifully with the 7 keys handout, which is available on their website. But like, here's mapping your ripple effect, so you can see these rings. And then like the big picture, which addresses like, here's my information seeking style. And here's
so Kathy, when you're meeting with a caregiver in a counseling session, have you been using these worksheets? And
yes, I
and
have.
I mean, that would look like a lot of homework. Does everyone want to do the homework, or do they want to talk and have you be a compassionate listener as opposed to going home and doing homework?
No, we talk and I'm a compassionate listener. I just offer these as a resource to take home and to just say, you may want to just look at this and it might be helpful to you. I'm never giving homework, never giving homework. But I've had people come back and say that I gave them 2 copies, one for them, one for their spouse, because they had very different perceptions of what was going on. And there's kind of a graph there. And I said, you could graph that differently and see how you both would rate this. And the person came back and said, yeah, we're looking at this differently. So it's just meant to be there. And it might not be something that they would use now, they might find themselves using it in a subsequent
Mm-hmm.
thing. They might be handing it off to their neighbor and saying, here, you need this.
Right.
So,
Because the relationship changes over time as the disease changes over time, and one's needs certainly change.
yeah.
Let's talk some more about the course that you are planning. Are dates set yet for when the book club is going to be?
Mary and I are working on that. I think it'll be in the fall. We're
Okay.
looking at how to break down 7 keys into 3 sessions. And I think I've got that kind of figured out. We'll probably be handling 2 keys per session
Mhm.
and then kind of wrapping that up. What's also lovely by these people is that they've given us kind of a guide of questions for a book club. But I think, too, this is the kind of information that, particularly when people are reading this and having their own stories, that probably it's just going to engender lots of conversation.
Right. I can imagine
Oh.
it's going to.
Oh.
Right, even without the worksheets, the people are going to have a lot to talk about. And speaking of a lot to talk about, I know we're going to have questions. So let's reserve the last bit of our time to questions. So we've got a live studio audience. They always get to ask the first questions. But if you're watching us live streaming this evening, please put your question in the comments section of whichever software you're using to watch us this evening. But we'll start here in the room. Poon, you get first question.
Thank you. Kathy, someone halfway through their battle or their journey, would you recommend they use the book?
Yes, I would, because I think it's not like this condensed or compressed, like here's all this information, it's all going to happen at once, any more than a cancer experience is. So I think you might pick it up and go like, yeah, I need to review, this is what I need to pay attention to now. It might just be 1 page and certain questions, or finding that I really need to work on inviting myself because I'm finding that I'm not getting the information I need, or now I'm seeing somebody new and I figured out this other person, but this person doesn't. We need to, how am I going to join with this other person who's treating me, and let them know I have questions or let them know my style. So I think it's good at any stage.
Yeah. And even as you ask the question, if you have a potentially curable cancer, the doc can easily outline what your treatment course is going to be, and you can easily go, okay, this is the milestone, I'm halfway through. If you're on a journey with incurable cancer, you never know when you're halfway through because you don't know when the end is. So, but I can definitely see as one's symptoms changes and their understanding and outlook changes, some of the questions may take on a different role.
Yeah, you might find yourself asking the same question in a different way because there's a different reason now. There's something different underneath it.
Tim.
Good evening, Kathy. I got a question on your clientele.
Mm-hmm.
So do you feel that the younger generation is more acceptable with the things that you do for them, the product you offer, versus the older generation?
So I think like your mental health counseling is our younger generation just more open to talking about their feelings and going to a counselor than, an old fart like me.
I would say yes. I don't have a lot of young clients. I have middle to older adults that I see, but I do have some, and their issues are different. And I think that I think if they're feeling heard, then they really find a lot of value in it, because there's also, as what they tell me is like, my friends don't understand this. I don't share this. I used to share the same interests with my friends and stuff, but now I have a parent with cancer, and my friends are nice and they ask me about it. But honestly, sometimes I don't want them to ask about it. I don't want to talk about it. What do I do then? And or just how they're framing their life. If they're worried about a parent or a partner or somebody who may not be with them as long as they hope or anticipate. So they have this really unique set of questions and issues. I don't ever find them to be reticent. And I had feedback recently of a younger person who came with their parent to an appointment. And I was a little surprised, and he wanted to come in. I was thrilled. And so I would direct some of the session to him too, and he would answer and respond. And the feedback I got was that he enjoyed that, and which was nice to hear, because sometimes you don't know if they're just like, okay, bored. But no, it's just sometimes a different dynamic.
George.
I've got a perspective that's probably a little different than what you've ever heard before, and that is aviation safety.
Oh,
When I hear you talk, I'm kind of the patient, like the doctor mentioned. Now, I made my decision. I'm in the doctor's office. He's my doctor. Take it from here. I'm going to go on about living. But the aviation industry determined that the more you inform people, the more they're involved, the more they're engaged, the more they're told about what's happening, the better things go for the vast majority of people. Is that similar to what you're experiencing? Or
I think from the standpoint of, say, in the aviation industry, you're getting kind of factual information about things that you may or may not be able to control, may or may not be able to see. And I think it's different when we can't see inside. I mean, there aren't exterior things. And because things change and it's got such an emotional quality to it, sometimes the amount of information can also be overwhelming. And so I think sometimes titrating that a bit, or just helping people to absorb information, and you can see if they're getting overwhelmed and say, that's enough for now. And
Yeah. So, George, when I think of the analogy you're making, I think of information, knowing what could go wrong. So, you know, in outlining what the course is, you do want to mention that sometimes your blood counts can go down, and we may have to pause treatment. You might have this side effect, this side effect. You can't possibly, it would not be helpful to go over 12 pages of all the possible side effects. But I do think that letting them know, especially when it's, you know, at least 20-30% chance you're going to have a side effect, to have heard about it and anticipated ahead of time. Also, you know, if you're on the runway and the plane isn't taking off and the captain's not talking to you and you're going, what? I mean, that's a very disturbing thing. If the captain is talking and telling you and explaining what's going on, it's very calming. So I don't know if that's the analogy, that knowing what to expect, and knowing some of the hiccups that might happen, even in a very successful course of treatment, can be reassuring when those little hiccups happen, that this is something that is customary and we can deal with it.
yeah,
Or did we answer? Did we get to the?
Yeah, I
root
was
of the
just struck by
question?
the two different types of patients and the two types of airline passengers. For instance, I get on a plane, you don't have to talk to me at all. I mean, until we land. I've made the decision. We're in the air, telling me what's going on ain't going to do anybody any good. But there are other people, like when they go into the doctor's office, they want to know everything. I mean, you talked about the scribes. I mean, they would like to record, write it all down, go home and study it, get books about it, research it, go to the library. Two different types of people. And I'm beginning to think that there are more of the people that are interested in knowing lots of stuff than old-fashioned people like me that really don't want to know much at all, you know?
I think that, and that kind of goes to that know your style.
Yeah.
So you know your style,
Right.
which is great. And I kind of know my style. Although I think if I had a certain kind of diagnosis, my style might have a bit of an adjustment. I don't know. And yet I kind of, I know my spouse's style. And so that's also comforting to me to know that if I'm, in a certain way that person can manage it. I also think too, one of the things, at least from the standpoint of information that I see, a lot of the caregivers that I work with, like when you talk about this might be a side effect, they want to know, what do I do then? Like, what do I do? How do I manage this? Do I give more of this? Do I withhold that? Is there a product that, what's my next move? And I think just knowing that is helpful. It's like, yep, call us if this happens. And these are and so, yeah, it's a balance.
And George, you mentioned like the different styles of do people nowadays want more information. I would say that because if you've got a computer or a smartphone, you have all the knowledge the doctor has. You probably don't have the wisdom, but it is so easy in a few keystrokes to get lots of knowledge about what's going on. So I do think that more patients have acquired knowledge that can be sophisticated. Depends which website they're on, because it might be that would not be the best website to get the accurate information. But there's no lack of information.
Yeah.
So that has changed because people do have more knowledge, and sometimes they do ask very probing questions. I mean, I'm not embarrassed to say that they may know of a clinical trial that I'm not aware of. And even the result of a completed clinical trial. You can't know everything. So I think it's a net positive, and especially when they're willing to bring their questions in and we can go over, their research and kind of put it in perspective.
Yeah.
Kathy, can you remind us of the title of the book?
Yes. The title of the book is Hope for the Best, Plan for the Rest. 7 Keys for Navigating a Life-Changing Diagnosis.
Thank you. Also, do you usually recommend your patients to pick up a copy of the book?
Often I do. I'm kind of Mary Poppins with bags of books that I bring to work and lay them out. And people say, is that for me? It's like, well, you could, and that's one of the lovely things about smartphones now is everybody just takes a picture of the cover of the book. We don't even have to write it down anymore. So I let them look. I have people look through it. I tell them why I like it, what I think is valuable about it. And I think too, when people are kind of overwhelmed with something, I might suggest the workbook versus the book, because sometimes when you have a lot going on, you may not have the concentration or the memory, although this is beautifully written. This kind of gets you right into it and, asks really good prompting questions or has checklists and maybe more user-friendly. It's all really good, but yeah.
Well, great. Well, thank you, Kathy, for being with
thank
us. We're
you.
excited to launch this new series that will happen later this summer. It'll start with a book club with the Above and Beyond Cancer, and then lead to some workshops for caregivers or life partners of individuals going through the cancer journey. Our guest has been Kathy Koenig, mental health counselor and grief counselor at the Mercy One Richard Deming Cancer Center. And I hope you have enjoyed this. If you know someone that would benefit by watching this program, it will be available on demand beginning tomorrow at the Above and Beyond Cancer YouTube channel and also the Mercy Cancer Center website. I hope you'll join us again next week. Thanks, everyone.